Hello everyone and welcome back to our channel. Today we're diving into the world of lumbar disc pathologies. Look at this cute little guy. That's a lumbar spine. This refers to conditions affecting the discs in your lower back. We'll break down different types of disc issues, associated conditions, and the various treatment options available, so stay tuned to the end. Let's get started. First, let's talk about what a lumbar disc is. The lumbar discs are the soft, cushion-like structures between the vertebrae in your lower back. That's this guy right here. These act as shock absorbers and allow for movement in your spine. When these discs become damaged or diseased, like this guy right here, pathologies can occur. Here's a rundown of the most common one. So a disc bulge happens when the disc extends beyond its normal boundary. It's like a balloon that's been pushed outwards. There are three main types of disc bulges. Number one, a broad-based disc bulge. This type of bulge affects a wide area of the disc, protruding more evenly around its circumference. Number two, a subarticular bulge. This bulge occurs just beneath the facet joints of the vertebra and may impact the nerve roots. And number three, a foraminal bulge. This bulge extends into the foramina, which are the openings or the holes where the spinal nerves exit the spine. And these can compress the nerves, causing pain or numbness. So a disc protrusion is a condition where the inner gel-like material of the disc, called the nucleus pulposus, pushes outward, but the outer layer, the annulus fibrosus, remains intact. It's like a bulge, but more localized. Protrusions can often press against nearby nerves, which can lead to symptoms such as pain, tingling, or weakness. You may have heard this called sciatica or radiculopathy. Disc extrusions occur when the nucleus pulposus breaks through the annulus fibrosus and leaks out into the spinal canal. This type of herniation is nasty, it's more severe than a protrusion, and can cause significant nerve compression. The extruded material may migrate and press on spinal nerve roots or the spinal cord. Disc herniation is kind of a broader and more general term that encompasses both protrusions and extrusions. It refers to any condition where the disc's inner material escapes its usual home, inside the center. Herniations can vary in terms of severity and may lead to that mean old sciatica where the herniated disc is pressing on a spinal nerve root. A central disc herniation is a specific type of disc herniation where the disc material pushes towards the center of the spinal canal. This can place pressure on the spinal cord or something called the cauda equina rather than just a single nerve root, potentially causing more widespread symptoms like difficulty walking, weakness, or coordination issues. If you ever heard the term cauda equina syndrome, it's severe and you need to get checked out right away if you're having these symptoms. So a sequestration is a type of disc herniation where a portion of the nucleus pulposus becomes completely separated from the main disc. This detached fragment can actually travel within the spinal canal, potentially causing nerve irritation and severe symptoms. It's often associated with more severe back pain and neurologic issues like numbness and weakness. You might have heard the terms free fragment and sequestration used interchangeably. What's the difference? What's the deal? Really, there's no difference. Essentially, they refer to a similar phenomenon. A free fragment is a piece of the disc material that has separated and it's floating within the spinal canal, while sequestration refers specifically to the complete detachment of disc material from the main disc itself. So in many cases, they describe the same condition, but with slight variations in the specifics. An annular tear is an actual tear in the outer layer of the disc known as the annulus fibrosus. This can occur to age-related degeneration, trauma, or repetitive strain. Annular tears can be painful and may lead to further disc issues down the road, including herniation. A high-intensity zone, or HIZ, is a term used on MRIs to describe a bright signal that we see on the T2 weighted images within the annulus fibrosus. We usually see these when there's a tear or degenerative change in the disc, and it's often associated with significant pain. The main problem with these annular tears is that they sometimes allow the inflammatory gel from inside the disc to leak out and irritate nerves on both sides of the lower back. But since the gel can float around from side to side, sometimes people think they're going crazy since the pain switches from left to right or vice versa. I've seen this. Don't worry, you're not crazy. Modic changes refer to alterations in the actual bone, the vertebral body adjacent to a degenerated disc. So the bone right here, we can see changes right on the edge of the disc. We can see these on MRI, and they're classified into 3 types. Motic type 1, these represent inflammatory change with increased marrow edema and can be associated with pain and inflammation. Motic type 2, these indicate fatty degeneration of the marrow, which is seen in more chronic disc degeneration and may correlate with less inflammation and more structural change. Motic type 3 is when normal bone marrow has been replaced with much harder, denser bone. All right, now we've covered the different types of disc pathologies, let's talk about treatment. Treatment can vary depending on the severity of the condition and your overall health. Here are some common approaches. Conservative care is often the best and first line of treatment and includes physical therapy, or PT, which focuses on exercises to strengthen the muscles supporting the spine. It can also improve your flexibility and reduce pain. Chiropractic care involves spinal adjustments to improve alignment and alleviate pressure on nerves. Inversion therapy. I love my inversion table. Don't ever take it away from me. This uses gravity to decompress the spine, potentially reducing pressure on the discs and nerves. Injections can provide more targeted relief. Epidural steroid injections. These are administered under live x-rays like that thing behind me, since we need to be very specific about where we're putting that medication. I mean, we're near your spine, of course. These steroids administered right into the exact location can help to reduce inflammation and pain in the affected area. Platelet-rich plasma, or PRP therapy, involves injecting a concentrated form of the platelets derived from your own blood into the affected disc and nerve area. PRP contains growth factors that can help promote healing and repair of the damaged disc tissue over time. As usual, surgery should be your last resort with disc problems, and the key is to make sure that you know what your diagnosis is and what all of your options are before jumping into surgery. Each treatment option has its benefits and drawbacks, and oftentimes a combination of these approaches may be used to manage disc pathologies effectively. It's important to work with your healthcare provider to determine the best treatment plan for your specific condition. All right. Thanks for tuning in. Don't forget to like, subscribe, and hit that notification bell for more health tips and information. See you next time.